Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. This is that one time a month, the one place a month that I answer your orthopedic injury, surgery, recovery, rehab questions. This is not medical advice. It's meant for general information and educational purposes, but I only do it here one time a month. I don't do it in response to the comments. I don't do it by email or anything else. I can't give you medical advice if you're not in a state where I don't have a medical license. So this is where I choose to do it. So hopefully that is why you're here. If you're a military veteran, have a question about the disability claims process, that is my 5:30 show on my Veteran Nexus Letters with Dr. David Geier channel, so definitely check that out. I won't do military disability claims, VA claims here, but if you have an orthopedic injury, if you have a question about surgery, a question about rehab, recovery, peptides, regenerative treatments, anything like that, this is your place. Like I said, it is not medical advice, but if you've been to the doctor, don't understand what he or she said, and you want information on what I think, try to translate that. Or if you've been injured but haven't seen a doctor, maybe I can shed more light on possibilities that then you go to the doctor and ask more specific questions, maybe better questions, and then you can make the decision that is best for you. If you want to ask a question, leave those in the chat, not in the comments below this video. I can only see the chat, so definitely check that out there. If there are no questions, and at least right now there aren't any, it becomes a very short show. But I will stay. Sometimes I'll be here 30 minutes to an hour answering questions, and then sometimes we don't have that much, which maybe today being Easter, the day after Easter, there's not a whole lot going on, but I do try to help. I do want to say real quick, and then if we don't get any questions, that'll be it. Starting tomorrow, April 7th, I've been working on a series of ebooks for a long time now, and there's a lot coming. I'm just sort of releasing them in stages, but I've been working on this a long time, but I've got 3 ebooks, and they will be out in paperback a few days after that. Amazon, Barnes & Noble, Apple, Google, wherever you get ebooks, they will be there. The paperbacks will be on Amazon and eventually on other sites, and there will be audiobooks at some point, but those will be a little further delayed. These are 140, 150 page ebooks, one on low back pain, one on knee arthritis, one on hip arthritis, are the 3 that come out tomorrow. 10 chapters each, deep dive in the anatomy, in the pathophysiology, what happens in the disease processes, non-surgical treatments, surgical treatments, recovery, preventative steps, all of it is in there. I'm very, very proud of these. This is my effort to help more people than I can in a one-on-one setting. Not everybody can come to Charleston, and so I want to help more people in sort of an easier way, which is why I created these. I've got ebooks and paperbacks that are going to come out about meniscus tears, ACL tears, rotator cuff tears, knee replacements, not shoulder replacements yet, but knee replacements, hip replacements, plantar fasciitis, tennis elbow. There's so many that I plan to release in the coming 12 to 16 months. So definitely check those out. You can find those in the description to the channel, this YouTube channel. There will be a link to my Amazon author page. You can get them all there. And like I said, the paperbacks will be out later this week. So, all right. Kales Chapman says, what are your views in being told by an orthopedic surgeon that your last and only option is now a shoulder replacement? 28 years old, osteoarthritis, confirmed 3 weeks ago. Yeah, that would be really bad at 28. Without knowing more of the specifics, and this is not medical advice, I would certainly want to know, the only reason to ever do a joint replacement, knee, hip, shoulder, is pain that is not controlled any other way, and usually that's significant bone-on-bone arthritis. Now the shoulder is not a weight-bearing joint, so the bone-on-bone is not all there, but it's where nothing else would work. Now I am a big believer that arthroscopic debridement, cleanup surgeries, are not helpful for arthritis, but is the problem truly significant glenohumeral arthritis, or is there something else going on, rotator cuff tear, labral tear, something like that, where there is a surgical option. But even if there's not, I think, and I'm not pushing regenerative treatments, obviously if you followed me for any period of time, you know that's what I've pivoted to. But a lot of times, especially for somebody 28, that can be a good option. It's not covered by insurance, but whether it's stem cells or exosomes or PRP or something, to even if it just delays the need for that surgery and delays eventually that surgery, that metal and plastic wearing out, which it typically will in 15 to 20 years, and then you're at 48, and then you need an even bigger operation. So those can be good delaying measures. Plus, if it improves pain and improves your ability to do certain physical functions, I never think that's bad. So I certainly would want to know more of the details and maybe consider other options. All right. Aaron Harvey, Dr. Geier, does a posterior root tear of the medial meniscus and extrusion have a major effect on ligament laxity, specifically the MCL? It has a secondary effect on laxity, not so much primarily, but it could. I don't think a root tear would cause an MCL injury necessarily. I would worry more if that was an ACL doing that, or maybe even a PCL, but without knowing the details. But that the meniscus does have a secondary role in knee joint stability, but not to the extent that the ligaments do, if that helps. All right, and he says bone spurs, thinning cartilage, glenohumeral joint, grade 4. So yeah, I mean, what it's saying is fairly significant arthritis, but I think that even then, it's got to fail other attempts at treatment, whether that's even, I'm not at all a fan of cortisone shots, but cortisone, physical therapy, hyaluronic acid injections, some of the regenerative things, even PRP, and before at 28. I personally consider shoulder replacement, but again, or reverse shoulder replacement. I'm not sure which they're talking about, but that might be a discussion with the surgeon. But that's typically the rule of thumb. Significant arthritis, unrelieved by any other treatments, limiting ability to perform daily activities, then I think it becomes a reasonable option. All right, looks like that's all we've got today. Again, definitely check out, again, in the description in the channel, to my YouTube channel, there'll be a description. You can find those ebooks. Definitely check those out there. I very, very much appreciate it. Whoever this is, I do not take federal health benefits. Our practice doesn't take insurance of any kind because regenerative treatments are not covered by insurance, and so our practice doesn't. For what that's worth. And now, if this is something related to military claims, again, that's a different show later on today, but I don't for that either, but that's a whole different discussion. But regenerative stuff, no, our practice does not take insurance. We are accepting new patients, but it is cash, credit card, health savings account, flexible spending accounts type things. We don't work with insurance companies or health plans. Okay, and Kale says, thank you. Very, very much appreciate it. Check out the ebooks and paperbacks on Amazon, and then in the next few days, wherever you buy your books, reach out to me on my website on the contact form if you have any questions about that. Very, very much appreciate these questions and question and answer sessions. I hope you have a wonderful rest of the day and rest of the month, and I will talk to you soon. Take care.